time is on, so we will start now. So my name is Ji-Yong Park in chemistry team in our department. So today I will talk about the radiopharmaceutical chemistry from clinical needs of Theranostics. Especially I wanted to discuss about the radiopharmaceutical and development. Because I'm a PhD, so my presentation was composed of some mechanism and some chemical structure and possible concerns for the application about radiopharmaceutical, especially diagnostic part. So I just explained about the aspect of view about researcher. So right after we have some lecture, and then we must think about that, about your own radiopharmaceuticals. So first of all, before I prepare this lecture, I just searching about the meaning about Theranostics. Theranostics means combination of therapy and diagnosis. In some radiopharmaceutical field can use both for therapy and diagnosis, especially of cancer. Radiopharmaceuticals emitting gamma ray or positron are used for diagnosis, and beta and alpha emitter are used for therapy. Thus, you already hear from the Dr. So, the peptide targeting a special cancer is labeled with gamma or positron emitters. Positron emitter for diagnosis, and same peptide is labeled with beta or alpha emitters. You already hear from So, the first diagnosis of octreotide derivatives is 6-8 gallium dot is positron emitter and is used for diagnosis of neuroendocrine tumors by imaging with positron emitter tomography. After confirmation of uptake, DOTA-TOC is labeled with beta emitter such as lutetium and yttrium or administered the same patient for the therapy. Then we can check the therapy efficacy can be predicted by, I already explained about that, the internal dosimetry and unnecessary administration. This type of concept is already studied in our field, but the other field also use like this Theranostics concept. For example, bioimaging guided radiotherapy delivery is possible way to use this Theranostics, and optical imaging and laser ablation and surgery also use this type of concept. They're so-called optotheranostics. And nowadays, some nanoparticle was also studied and come into our diagnostic part. And then interventional oncology and basic sciences also study about the diagnostics. The radioactive compounds used for the diagnostics and therapeutic treatment of human disease, the radiopharmaceutical normally labeled with radionuclide. The main point of view of this method is the concerning about safety and non-toxicity. Because you already know our radiopharmaceutical was really small amount of drug was injected to the human. So for the human, in some case of human administration, it was confirmed that safety and non-toxicity. And moreover, the nuclear medicine fields normally use the metabolic imaging agent, for example, FDG and iodine and phosphonate. So if we can label successfully about the diagnosis radio stuff and therapy radio stuff, we can easily take some imaging and easily go through the therapeutic efficacy. There was some kinds of possible contents about using radioisotope for the diagnostics. First is the RI only case. You already know about the RI only case, for example, iodine therapy, and injected to the technetium for the checking the gland image. Next thing is we already know that the carrier added one, it means that the RI ligand type. For example, we can check the kidney function. We use the this type of radioisotope. The main application of this radiopharmaceutical is the radio labeling drug. And after that, we can use this type of concept to the new one. It means the new targeting ligands, and then we can easily make some radioisotope labeled one. In present and future, we study about the nanomedicine. It means that we use the nano for the additional modality, and then we conjugate it to the radioisotope in surface or increasingly labeled of the nanoparticle, and then we can successfully image it about the Theranostics image. And then more advanced one is we can use the nanoparticle and radio labeled one and drug loaded one. So in radionuclide labeled radiopharmaceutical, we so-called radio indicator or radio tracer. This is a this is you already know about the FDG. Because of the FDG is a sugar, is the main energy source for the cell, and then in case of cancer cell gives a high sugar consumption compared to the normal cell, so we can easily make some image about using like this. So right before we study about the FDG, in some aspect of researcher, we must know about the mechanism about the uptake and retention. Normal glucose was uptake by glucose transporter colloid, and then after it was uptake to the cell, some severe enzyme was phosphonated to the glucose. So it was, after it was take some pathway, it was go out the form of CO2. But in case of F18 FDG, the C2 position of the F18 labeled one is impossible to additional enzymatic pathway, so it was retention in the tumor cell. So I will talk about the possible diagnostic radioisotope and possible therapeutic isotope. We must know about the previously studied and previously commercialized one in this field. First, easy to use radioisotope is the 99M technetium. Technetium, its half-life is 6 hours, its energy is gamma and 140 keV, and it is easily produced by generator. And rhenium is relatively same physical and chemical structure compared to the technetium. So we normally use the rhenium is the same chelator compared to the technetium. So if you can image it using technetium 99M, and it means that it is possible to imaging and possible to therapy using the 188 rhenium. Rhenium physical property is the half-life is 16.9 hours and is showing gamma ray 155 keV, and it also emits emission about beta particle. And it is also produced from the generator easily, so it is possible to use in our facility easily. Normally, we use like this type of technetium and rhenium one. We must prepare about ligand. It means that DTPA, HMPAO on macroaggregate albumin. And then we labeled of this 99M and rhenium. We added some reducing agent to the kit. And for the stabilizing of this kit, we just adding some chemical ascorbic acid or xanthostic acid or tartrate or citrate. This is general 99M technetial labeling method. First of all, we must check the kit sterilization. After that, using proper shielding system, we can elution of technetium 99M from the generator. And then we adding some technetium 99M to the kit and then gently stirring. If needed, you can add some stabilizer and the reaction under the RT or heating condition. After that, we must check the labeling efficiency by TLC. This is our facility. This is the lab of the radio labeling facility, and this is the generator. And for the labeling, we must use the adequate shielding system, RI hood, and then this is a reaction shaker, and this is a heating bath. And then if we want to more precise experiment, we can use the clean bench, and then THC scanner is already setting in there. Technetium is each chemical structure like this, so each physical radius is really resembled with iodine. So that's why it was easily uptaken to the gland. So normally we use this technetium 99M labeled with phosphonate because it's really well coordinated to the phosphonate about this like electron donor sites oxygen. And then this phosphonate was really well uptaken to the bone because of it is the ingredient of the bone marrow. So after we labeling, we can take some image about bone marrow image like this. And the other application is the kidney imaging agent of using technetium 99M. Compared to the MDP, this type of radiopharmaceutical contains lots of hydrophilic site. It means the carboxyl group. So after labeling that, it was go directly to the kidney, and then we can check the kidney function like this image. And then I already explained about the technetium 99M and application to the 188 rhenium. So DTPA is same chelating agent about the technetium 99M. We can use the rhenium using same method. In this case, the rhenium is a relatively high or harsh reaction labeling condition. And then rhenium is therapeutic radioisotope, so it must be confirm the safety. So we must do well shielding shielder contains to the rhenium solution, and then we automatically output the solution to the vacuum vial, and then we added using saline and then labeling with the DTPA kit, and then 2-hour boiling reaction condition, and then we extracted the hot form from this kit and then injection. I already talked about the diphosphonic acid derivatives previously, and then we study about the 99M and rhenium also. The other application about this type of technetium and rhenium radioisotope is the colloidal radiopharmaceutical. The MAA is the macroaggregated albumin. It's a size of a millimeter scale, so it was go directly to the lung. And sulfur colloid and thin colloid and antimony sulfur colloid is also made using 99M technetium and 188 rhenium. So it is possible to imaging and cure about the liver or spleen and lymph node. This is the image of the antimony sulfur colloid. This star shape is the injection point, and then you can see the lymph node in like this. This is a relatively same, same chemical and then different radioisotope, but an imaging of relatively same. Because of the radium is co-emitted of gamma and beta, so each image is not good, but we can easily find that its distribution is relatively same. This is the same material and injected to the human study. You can see the more clear image using technetium, but the radium image was so not good compared to the technetium, but it is possible to therapeutic efficacy. Especially when in thin colloid, it was possible to use radiation synovectomy or peritoneal effusion and pleural effusion, and it is possible to injection to the direct tumor injection or arterial injection. The patient response of using this is good, showing some good response rates, and it was possible to cure pain and tenderness and joint swelling. And it is also it is also safe because of the minor leakage of the regional lymph node and urinary system, and they're showing no hematologic side effect. And we can also evaluate the leakage until 3 hours by imaging of gamma cameras. The last things of using this type of radioisotope is the lipiodol and radium HDD. You can see the different chemical structure about here, because this is long alkyl chain, means really hydrophobic. So we already know this type of chemical was well uptaken to the liver. So you can see the mouse image was after injection, it was well uptaken to the liver side. So using this type of radioisotope is already used for the liver cancer supported by IAEA. Out of 67 patients, 69 is stable disease, 4 is competitor partial response, and 3 patients showing some progressive disease. So some aspect of using of this type of generated one, we must know the elution profile. This is commercialized one from the Oak Ridge. It was showing some high activity on elution volume, not 5 to 10. But in our country already set up the radium generated system, we can easily find the high activity from the 1 to 2 ml system. It means that it is really easy to control the total activity of radium, and then it is really small amount of the volume is possible to use for the labeling. And I already explained about this application about the radio-labeled one for the therapeutic agent. So the really applicable example is the radio-labeled anti-cancer agent. For the drug evaluation, normally we use the radio-labeled drug for the predicting chemotherapy response. This image is F80 labeled paclitaxel. You can see the response site of here. The next example is the next radioisotope is 6A gallium. We easily use the 6A gallium from the generated system, and it was emitting positron only 89%. So it is really easy to access and really easy to image about PET scanner. And more interesting thing is this its ionic radius. This gallium ionic radius was really resemble with the iron. So this iron is using a relatively same chelator because of the size. And then its coordination number is 4 or 6. We can choose the adequate chelator using like this coordination number. This is the basic study about gallium-NOTA labeling yield. We already set up the gallium-NOTA labeling condition, and we just know about the possibility of the other radioisotope, especially metal radioisotope. So after labeling NOTA, we can add some different concentration of this iron solution, and copper solution, and indium solution, and this gallium solution and magnesium solution also. After adding some kinds of solution, it means that the 31.5% of gallium-68 was detached from the gallium-NOTA structure. It means that it is competitive reaction compared to the copper, and we can use this NOTA chelator to labeling with copper also. And indium showing more higher detached percentage compared to the copper, it means that it's more better chelation than copper, and it is possible to chelating using NOTA. So use this 6A gallium radioisotope, we can easily labeling a peptide or protein or other nanoparticle. In this case, we must use the bifunctional chelating agent, so-called BFCA. And then use for small molecule, we must knowledge about the coordination chemistry. Normally in radiochemistry field, the chelation method is indirect lip method for the labeling because of we use like a spacer as a chelator for the labeling. So normally we call the indirect method for the labeling. If we want to labeling some peptide, for example, ligand, you can conjugation with the bifunctional chelating agent right before radio-metal reaction. To make some stable complex with 6A gallium, we normally use DOTA or NOTA because of the coordination number of gallium-68. But the only chelator coordination number is not the concern of our labeling. We want to more better labeling efficiency. We must concern about the specific conditions. For example, pH and temperature or reaction time will be must adjustment for the application of radio labeling. And some peptide example is already explained from Min-Seok's lecture, especially he told about the 6A gallium labeling and lutetium labeling. So not only the kinds of ligand, there are so many kinds of peptide labeling, peptide ligands already exist. The Bombesin analog and RGD analog is already studied, and then you already see the DOTA derivatives analogous for substance P and neurotensin and chlorocytokine B also. And small molecule is also studied about using 6A gallium labeled one. And then more application is nowadays we use this kind of methods to the biomolecules, especially antibody or albumin also. And the nanomedicine field was used this kind of labeling methods to the nanoparticle because of the nanoparticle have lots of possible modality for use the multimodal imaging. This is an example about Ga-NOTA RGD for the angiogenesis imaging. You can see the chelator in here and then target ligand in here. So I will explain about the importance about the linker. Especially, we use the linker, use IOSI or real linker, not the amide bond linker, because in this case, it was not reacted with our natural enzyme, so it is relatively stable than other kinds of linker. So this is an animal study. Without cold RGD, you can see a clear uptake to the tumor site in here. And then we use the cold RGD for the blocking. You can see the faint uptake to the tumor site. For this type of radio pharmaceutical for clinical daily routine uses, we must make the key formation. Key formation contains some specification like here. And then we can use this type of kit for the human study. Next is the consideration for the radionuclide therapy. Radionuclide therapy is using radionuclide, especially therapeutic uses, and then its therapeutic pathway is the internal radiation nucleation therapy. So we must know exact radionuclide and exact application and exact property about its chemical and physical properties. In some case, we use these radionuclides with or without carrier. This is a comparison of the external radiation therapy and internal radiation therapy. You already know about the external beam radiation therapy is the emitted some radiation from the outside of the body, and then we can coordinate exact sites of the tumor or other pathological site, and then we can cure some or defect of the pathological region. But in radiopharmaceutical, we can inject to the tumor using intravenously or intraperitoneally, and then it was targeting to the target site. In there, it was emitting some therapeutic efficacy. For the radionuclide therapy, we must consider some kinds of factors. First is the properties of radionuclides, and then second is the targeting. It means the targeting moiety like RGD or peptide or the other kinds of antibodies. And then we check the effectiveness using in vivo and in vitro experiment. And then for the labeling of adequate radioisotope, we can select some chelator and adequate carrier. After that, we using some image and we take some dosimetry data. And finally, we must check the cost problem. There were 3 kinds of radionuclides for the radionuclide therapy. One thing is alpha emitter, and beta and alpha emitter is possible to use. They have different kind of physical property. About alpha emitter is high energy and high linear energy transfer, and it was really expensive. And beta emitter have some low energy level and low LET, and it is cheaper than alpha emitter. Alpha emitter is also possible to use for radionuclide therapy, and it have shown low energy and medium LET. This is possible radionuclide for radionuclide therapy. You can see the iodine, yttrium, and lutetium, and rhenium and radium. And normally, normally you can see the beta emission. It was used for the therapy, and then gamma is possible to use the imaging, especially for example, the SPECT imaging. The concept of linear energy transfer is the it is related with the therapeutic effect. Beta and alpha and electron capture was showing some particle about electron, helium nucleus, and outer electron, but it was different. It was showing different energy level. The beta is medium and alpha is high, and electron capture is low. So it was showing some different range of about the linear energy transfer. We must choose adequate radioisotope for the application of this kind of radioisotope for the radionuclide therapy. High LT means alpha ray and proton and heavy ion on outer electrons. So it was directly affected to the DNA damage. So and low LT means beta ray and gamma ray X-ray. So it was in the kinds of isotope was injected to the injection to the human. It was formation of radical and ions, and it was showing a secondary breakage of DNA. This is a penetration figure about beta and alpha and outer. You can see the relatively long pass ranks about beta, and alpha and outer is showing relatively short pass ranks compared to the beta. And it means that more small size of the tumor is possible to use the alpha emitting radioisotope, and then we can treat it about beta emitting radioisotope for the more larger tumor site. So beta emitter showing energy disposite outside of the cell it is possible to targeting cell macro cluster and metastasis. So our parameter is really relatively short LT, so it can be possible to targeting isolated cell and microcluster. So this is the comparison about the yttrium and iodine. Yttrium has no gamma emission, so it is impossible to image it. So, but its half-life is relatively short than iodine, so it is relatively easy to comparing some other factors compared to the iodine 131. So you already hear about this type of PRRT from the Min-Seok Soo. And then this is the concept of the radiopharmaceutical using peptide or protein. We are using the kinds of radiopharmaceutical using some therapy or diagnostic radioisotope. We can use the adequate chelating agent and adequate covalent linkage to using some target ligands. The main point of this kind of radiopharmaceutical is the stability. So there are some kinds of chelator making some stable chelating with radioisotope. The NTS2 structure was possible to rhenium, and DOTA is possible to yttrium and lutetium, and theta is possible to copper. So that previous slide I will show about the targeting moiety about peptides or protein. There are some kinds of some targeting molecules, small molecules or peptide or protein on nucleotide is also possible. And then we can choose some specific target ligands and specific spatial and specific chelator. We must make some plan about specific tumor or patient stage, and we can use combination therapy or not. So after that, we can use some kinds of concept to the radionuclide therapy and check the concept of the obstacles for the radionuclide therapy, and then we check the effectiveness and chemistry. The checkpoint of the radiochemistry part is will presented by Yoon Sang Lee the after session. So this is the last session of my presentation. Is this take-home point. You already heard the previous lecture about the clinical field and then clinically uses of a radiopharmaceutical, but my major is the basic science, so I'm really concerning about the application of the new radiopharmaceutical. For example, if I want to use my chemical or my particle to the in vivo field or in vitro field, there is a two main strategy about to use like this kind of study to the more advanced one. One thing is pathology or biological based study, but it was based on the pathology and biological base, but the more basic one is the chemical properties. So this is my experience about the using some technetium radioisotope for the imaging of third gas transmitter. We already know the pathological knowledge about the some information site was emitting some gas transmitter, so-called hydrogen sulfide. So we already know the knowledge about the cyclane and 64 copper labeled one was really well coagulated to the H2S sites. In that kinds of knowledge, we use that kinds of knowledge. We use like these kinds of some alpha hydroxy acid for the hydrogen sulfide imaging. We labeled all kinds of this type of hydroxy acids, and then we check the percentage of the insoluble compound ratio, adding some NaHS and glutathione, and also all the other kinds of the possible gas transmitter. And we can find that high insoluble compound using gluconate and glucoheptonate and glucalate, and then we use some mouse image. We take some mouse image using the H2S produce the chemical NaHS and glutathione. We can make some artificial tumor site in here and here, and inject it to the technetium gluconate in using the IV, and also injection to the technetium labeling citrate in also IV. So the previously in vitro tests were also showing some high percentage of insoluble compound using some gluconate. So it was also showing high uptake to the artificial tumor site because of these kinds of radiopharmaceutical makes some insoluble compound in this site. And then after that, we used some animal modeling, especially it was inflammation-induced mice, and then check the possibility of the H2S capturing and imaging using we developed one. The beauty of this H2S imaging is that the technetium gluconate and technetium glucoheptonate are already approved radiopharmaceuticals. The other possible way to make some your own radiopharmaceutical is the material-based study. In this study, I used some albumin as a nanoplatform, and then make some albumin nanoplatform for the multimodality, for example, fluorescence and targeting material, and their radio labeling. Using that type of nanoparticle was possible to use for multimodality and optimizing targeting and therapy. So before we use this radio nano platform for the pathology study, so we check the biodistribution of our nano platform. DOF means a degree of functionalization of albumin. So we can use only one functional group, and we can use only five functional group, we can use 8 functional group, we can use a 13 functional group. There was showing a different biodistribution, and then we can check the half-life, and we select the adequate type of nano platform, and then use for the further study. So we can choose the type 2, it means the degree of functionalization of 2, and then you can see higher uptake to the tumor side. And finally, we can check the biodistribution study for the possible uses of this non-platform for the other kinds of tumor application. If you can possible to make like this nano platform or other your own radiopharmaceuticals, you can easily make some. You can easily use this type of research thema to the other fields. So we only make some one type of nano platform, but we use some different type of application. We already writing some paper and publish easily. This is the end of my presentation. Thank you for attention. And then if you have any question, fully ask to me.
Where you're going to, can you predict radiolysis happening?
Radiolysis when we design or making a new radiopharmaceutical. Radiolysis.
For the first question, can we predict the radiolysis happen when we design or make a new radiopharmaceutical? Yes, we can do, but because of the high energy of the radionuclide, so you can expect that normally the chemical structure labeled with the temperature, then that can also affected by the radioactive nuclide. So if the compound has some kinds of chemically labile structure, that means we can expect that also happen in radiolysis. But for protection, prohibit the radiolysis, we can use several different methods, such as adding xanthisic acid or ascorbic acid like that. Then we can prevent the radiolysis, actually. But they possess a chemically labeled structure that normally that radiolysis also happen more. Okay. And last question is that if you don't have a TLC scanner, we can do the TLC, because if you have a dose calibrator or gamma counter, just cut the center of the TLC strip and put that half of strip, and you can measure the radioactivity, and then you can calculate the RF value 0, that is the origin, and also RF value 1, that is the front line. So you can compare the origin and front line, then you can calculate the RF quality control radiopharmaceutical also. All your same situation in our department, so we normally use the gamma counter or dose calibrator for quality control, the TLC method. Okay. Okay, thank you.
Dr. Park, actually, I can just ask you to answer to a long-standing question. So Professor Yoon Sang Lee and myself, we discussed almost every time once we see the strange the image results after injection of the DOTA labeled gallium or DOTA labeled other compound. Then we wonder whether that metal gallium gallium would have been liberated from DOTA, NOTA, or others. So, but in your table, I have seen the copper chloride or others are going to just to displace the gallium from the labeled situation to the unlabeled. So that concentration is a feasible concentration in vivo, so that we would be concerned about the possibility of gallium, labeled gallium is detached from DOTA or NOTA in vivo. So have you understood?
Yes, I understood.
Yeah, yeah.
I think that the concentration is not resemble with the human case. It was the in vitro concentration relatively high. So I think that we already checked the stability in human serum more large volume than a labeled one. So I think that it is impossible to exchange it to the other kinds of metals because of if it is competitive reaction, the competitive metal is really small amount in our body. So I think that it is impossible to exchange the chelating system like a NOTA or DOTA.
I think gallium prefer NOTA system than DOTA system because of after the labeling, gallium DOTA will make a detachment in the vivo system, but I think a copper 64 also prefer NOTA than DOTA. So normally after detachment of from the DOTA in the copper system, that copper will accumulate in the liver. So if you inject a copper labeled compound, if they show the high liver uptake, then you can expect that is a translation into the copper 64 into the liver. But in case of gallium, that detachment is happened. That gallium normally translated into the transferrin, and then first, I think that portion is very less than, I think normally more than 90% is passed through the kidney excretion.
Okay, so for the time being, we can be sure that the NOTA labeled gallium is going to be stable in vivo, unlike not following this table in vivo. However, there is a phenomenon of transchelation in vivo. Okay, so every time we cannot be sure, and we need to be concerned. Okay.